Today we will be discussing the physical effects of electromagnetic radiation on cells and DNA and why they are harmful, but still used in medicine.
Electromagnetic radiation affects the cells and DNA of the entire body. So what are some physical effects of electromagnetic radiation on cells and DNA?
EMR affects the neurons throughout the body, but also on the brain chemistry. It is interesting and worth to note that the most commonly decreasing brain chemicals were epinephrine, norepinephrine, dopamine, and 5-hydroxytryptamine. This may lead to bradycardia, which is evidence that the neurons may have been exposed to radiation.
Radiation ionizes atoms, which may affect molecules, cells, tissue, organs, and the whole body. Each cell is mostly water. There is a high probability of radiation interacting with the water. Radiation breaks the bonds that hold water molecules together, and their fragments can form toxic substances such as hydrogen peroxide, which can destroy the cells.
Optical damage can also be a result of EMR because it can cause cataract development if a power density greater than 100 megawatts per centimeter squared is used on the patient.
Not only does EMR affect the eyes, but it also affects the immune system. When the specific absorption rate is greater than 4, it alters the lymphocyte responses. Thermogenic levels of exposure have been found to decrease natural killer cell activity and activate macrophages.
EMR also affects the endocrine system. Exposure can lead to an increase in plasma cortisone, with cellular vapor in excess of 3 watts per kilogram, depending on secretion of adrenocorticotropic hormones from pituitary glands. Changes in fetal melatonin have been reported after 2 weeks of exposure, the electromagnetic field exceeding 1.7 watts per minute in air, leading to possible endocrine cancers. Now, it is worth noting that melatonin has been shown to help with fighting breast cancer because of its anti-proliferative properties that it contains.
Overall, EMR has many harmful effects on the body. It can lead to changes in the patient's physiological state, causing dizziness, amnesia, and tiredness, genetic effects, and immune function.
EMR also can cause a higher chance of getting bradycardia, which basically means a slower heartbeat.
But EMR also has positive effects as well, such as increased lymphocyte. When you have a high lymphocyte blood count, this means your immune system is working as it should to fight an illness.
You're exactly right. Lymphocytes include our white blood cells, natural killer cells, and T cells, along with others, which help our body bolster our immune system and fight off any bad illness that our body may have contracted. So, why do we continue to use EMR throughout medicine?
Without the use of EMR, we would not be able to diagnose patients with the correct illnesses and give them a proper treatment. Many machines that expose people to radiation allow us to look at detailed images within the body, as well as allow us to give proper treatment to patients.
Exactly. Now, it is worth noting the physics behind the EMR, as gamma rays are used to disrupt the cell nucleus and dislodge electrons from the molecule. X-rays and gamma rays are called ionizing radiation, since individual photons of such high frequency have enough energy to ionize molecules or break chemical bonds. These radiations have the ability to cause chemical reactions and damage living cells beyond that, resulting from simple heating. The energy of an individual photon is greater for photons of higher frequency. This relationship is given by the classic formula we all know and love, Planck's equation, E equals hf, where E is the energy per photon, f is the frequency of the photon, and h is Planck's constant, which is equal to about 6.62 times 10 to the negative 34th power joules per second, which is an astronomically small number. A single gamma ray photon, for example, might carry 100,000 times the energy of a single photon of visible light. So, just to put that into perspective for you, imagine one person in a whole stadium, and then imagine a whole stadium completely full of people and players. That's a huge difference, and you can just see how much more powerful these gamma rays are, and why they can potentially be very harmful to cells. But, of course, they can also be very helpful for us, which now brings us to MRIs.
MRIs are used for diagnostic imaging. This machine uses strong magnetic fields, magnetic field gradients, and radio waves to generate detailed images of the body. Another use, RF ablation, is used in cardiology and cancer therapy. It is a procedure that uses heat generated from frequency alternating currents. So without the use of these technologies using EMR, we would not have the diagnostic abilities or treatments to give patients the most extensive care needed. And that is why EMR is used so frequently in medicine today.
All right. Thank you for listening.